The vaginal rejuvenation procedure is a procedure that's done to normalize and reconstruct the opening of the vagina so that the caliber of the opening of the vagina is normal. That's done by bringing the muscle of the perineum or of the opening of the vagina back to its original state before pregnancy so that the entry caliber is normal. The second part of the procedure is addressing the laxity in the vagina itself, and that's done in a number of ways, but primarily by bringing the tissue underneath the vagina together so that it restores the normal tightness or caliber of the vagina itself. Patients come with the complaint of looseness during sexual activity and less friction perceived by them and then possibly their partner as well. And it's mostly patients that have undergone childbirth in the past. There's two subsets of these patients. Some are patients that just delivered and the vaginal tissue itself has remodeled in a way that's led to those changes. In those patients, the laser actually is a very good option because it remodels the vaginal tissue and sometimes restores the normal function of the vagina itself in a non-surgical way. Patients that also have relaxation of the opening of the vagina are not great candidates for the laser because the laser does not remodel or bring together the muscle of the perineum or of the opening of the vagina. The second set of patients usually come in with the same complaints, but on exam, it's not just a looseness of the vagina itself or a remodeling of the vaginal tissue itself. Rather, it's a pelvic support problem where prolapse or protrusion of the vagina itself is leading to the symptoms of vaginal looseness. In these patients, laser is not a good option, and a straight tightening procedure is not a good option either. The amount of vagina it would take to tighten the vagina would lead to an unacceptably short length of the vagina. These patients, we usually recommend a formal prolapse repair where the bulge into the vagina is corrected and the vagina is elevated so that the length is preserved. So on the illustration that we've been referring to, the vagina just falls into the category of just looseness of the vagina itself. And this could possibly be a candidate for the laser or for the surgical vaginoplasty or vaginal rejuvenation surgery. In the before and after pictures, there's a wide variety of patients, and most of them fall into the category of the patients who present with symptoms of vaginal looseness, but also have accompanying pelvic organ prolapse or prolapse of the vagina. In these patients, the procedure that was done was not only a reconstruction of the perineum or the opening of the vagina, but also a elevation and reconstruction of the vagina itself. Oftentimes, patients who present looking into vaginal rejuvenation also are complaining of the appearance or the function of the labia minora. The labia minora are intimately connected to the perineum or the opening of the vagina, so those procedures could be done in an associated way.